Is audio video fine? Very good evening, every student. Can we start? Yes. Thanks for the update. Audio, video, everything is fine. So, beta, let's start this most important question series. And the motive of conducting these session is to give you a message which are the important topics, mandatory topics, and we should use the upcoming days for revising these topics nicely. Is it audio video fine? So beta, what the plan of action for next 60 minutes? I'll be giving you 20 important topics which are must read topics for the upcoming NEET examination. Clear? These topics should be on your tips, and if I ask you, beta, revise these topics, you should be in position to revise in 5 minutes. Beta, isko target lena hai. Let's take this as a target, get all the topics, and I will make you revise in the session itself. I will tell you how to manage to revise these topics in 5 minutes, because in the last spell, it is number of the revisions which will decide your rank in the examination. Is it clear? So let's revise more. And now you are getting upcoming days. Utilize these days not for adding the topics, not for adding the points in any topic. It's better to revise whatever we have studied. Clear? So one student writing in the chat box, okay, sir, we are missing your words, behave like a 10 standard. Absolutely, beta. In the examination, you have to behave like a 10 standard student. You remember in the 10 standard what you used to do physics? You used to learn one concept of physics and you used to apply on 20 numericals. Now what we are doing for the last 4-5 years, we are just mugging up all the 20 MCQs. Clear? Dr. Morphine, beta, what message I am giving you now? I am giving you the truth of life. Last 5 years, we are mugging up all the 20 concepts. It's better learn the concept and apply on the 20 things, beta. So when you appear for the examination, you will realize that academics learning is 70 to 80% and the remaining part is the state of mind which you enter in the examination hall. Is it clear? Let's start the game. Clear? Coming to the next point. First MCQ, 4-year-old child with suspected foreign body on examination. What is the motive of this question? What is the MCQ? What is the main aim behind this MCQ? Type of dyspnea. You should be master of type to locate the type of dyspnea. Where is the injury? You have to manage, you have to label where is the injury. We have to decide. Is it clear? So let's start. One second. Give me 1 minute. Yes. Now, so motive of this MCQ is to give you a message how to decide the site of lesion. You should be confident. If it is inspiratory dyspnea, it is supraglottis. If it is biphasic, it is hoarseness. All these concepts should be on your tips. Clear? Is it clear, beta? Is this concept clear? So the motive of first MCQ, the first point which you should learn in a nice way, that is your type of dyspnea. So always remember the bronchial, the lower respiratory tract, if there is any challenge in the lower respiratory tract, it is always expiratory dyspnea. So in my MCQ, they will be asking you expiratory dyspnea is seen in lower respiratory tract. Larynx, if it is supraglottic area, it is inspiratory dyspnea. Everybody should write in the chat box inspiratory dyspnea. If it is glottic area, then I will be going for biphasic dyspnea. If the examiner asks you glottic area, it is biphasic. Subglottic area, again biphasic dyspnea, but beta क्या होगा, glottic area will be having one symptom, that is hoarseness. And if the examiner mention the word palpatory third or audible snap, these two keywords are made for trachea. So the right answer in this MCQ will be trachea. So let's revise one day before the examination. So expiratory dyspnea. Dyspnea mode during expiration is equal to lower respiratory tract. Lower respiratory tract. If the examiner asks you the supraglottic area, it is inspiratory. Glottic area is biphasic dyspnea with hoarseness. Subglottic area is biphasic dyspnea only. If the examiner mentioned palpatory third, auditory audible snap, I will be going for option A, trachea. Is it clear? From here, I am taking the PYQ of 2023 and PYQ of 2024. Last 3 years PYQ should be on your tips. Trachea, tracheostomy 2023. What they have asked you, beta? Which of the following is not a indication of tracheostomy? So you should be confident. Upper airway examination. Upper airway examination is not a indication. And 2024, they have shown you the X-ray where trachea is deviated and which procedure will be difficult in the given patient. Answer will be tracheostomy. Is it clear? First MCQ, strong message to everyone, every student. बेटा याद रखेंगे, इस पॉइंट को याद रखना है आपने. लास्ट 3 years PYQ should be on your tips. आज सेशन के बाद ना take a print out of all the MCQs which were there in the last 3 years. Your Central Institute, your NEET, your FMGE, and all these 3 question banks should be on your tips. Like tracheostomy, सर क्या क्या क्वेश्चन आए लास्ट 3 साल में? सर 2 आए. विच ऑफ द फॉलोइंग इज नॉट ए indication of tracheostomy, and one is deviated trachea, which procedure will be difficult. All these points we have discussed, it should be on your tips. Is it clear, beta? First MCQ cracked. First, the motive behind first MCQ clear. Second, this is what I have discussed with you, formulas. Pharynx supraglottic is equal to inspiratory dyspnea. Glottic, subglottic. Here is a catch. Your Central Institute people, they raise the query on cervical trachea. If cervical trachea is involved, it is biphasic. Always remember, upper part of the trachea performs same as a subglottic area. Is it clear, beta? Is the concept clear? Thoracic trachea and bronchi will be having expiratory dyspnea. अगर मेरे क्वेश्चन में होर्सनेस आया, चेंज इन वॉइस आते ही हमने क्या टिक कर देना बेटा? ग्लॉटिक एरिया टिक करना है. सो कीवर्ड्स, वन इज PYQ, वन इज कीवर्ड. एवरी टॉपिक कीवर्ड शुड बी on your tips. Coming to the next one, this is again a very important PYQ. Which of the following will have maximum hearing loss? And now बेटा अगर मैं आपको ना रात को मिडनाइट आपसे मैं पूछता हूँ यू आर इन ए डीप स्लीप में मैक्सिमम हेयरिंग लॉस, तो यू शुड रिप्लाई कि सर वी नो इफ tympanic membrane is perforated, sound will hit the promontory. If tympanic membrane is intact, no sound will hit the promontory, more loss. ये स्टेटमेंट आपको आनी चाहिए. यू शुड बी कॉन्फिडेंट कि व्हाई एग्जामिनर इज आस्किंग. क्यों पूछ रहा है यार? उसने किताब को ही खोली है. एग्जामिनर हैव नॉट ओपन द बुक टू मेक द MCQ. ही इज सिटिंग इन द OPD एंड इज मेकिंग द MCQ. Always remember this point. So never go with a quantitative learning के सर हमने रिसर्च वर्क करना है, एक एक कॉन्सेप्ट को पढ़ना है ना. We will learn what is the paradox of this topic. Paradox of this topic is if there is perforation with ossicular damage, it have less loss, 38 decibel, and if there is a intact tympanic membrane with ossicular loss, it is 54 decibel. So which of the following have maximum hearing loss? That is ossicular discontinuity with intact tympanic membrane. I hope you are getting the concept, बेटा. ये बात समझ में आ रही है? आ रही. अब ध्यान से सुनना. What is the catch in the MCQ? Examiner will give you 2 options: ossicular discontinuity with intact tympanic membrane, or one more condition. Can you fill up the blank? What is X now? If it is around 54 decibel, ossicular discontinuity with intact tympanic membrane is around 54 decibel. One is ossicular discontinuity with intact dump. What is the other diagnosis? Other diagnosis is complete fixation of the vocal foot, complete fixation of the foot plate of the stapes, complete fixation of the stapes. Is it clear? And if tympanic membrane is perforated, it is around 38 decibel. Which other condition have same hearing loss? Partial fixation. Partial fixation. This is the concept for your upcoming NEET examination. यहाँ पे हम एक स्टार मार्क कर लेते हैं. If the examiner is making the question, either he will make on this classification this decibel, or he will ask you SADE classification and TOS classification, which are classification for your retracted tympanic membrane, and I have given one MCQ on that. Match the following question. Is it clear? So this is the second must read topic, most important topic, which should be on your tips. Is it clear? What is the paradox of topic? अगर मुझे डेसिबल याद नहीं है 54, 30, and I'm not recommending कि you mug up the decibel, just remember एक चीज याद कर लो कि if it is intact tympanic membrane, it will have maximum hearing loss. Is it clear? Crystal clear. Done. Coming to the next MCQ, identify the fracture. Trauma, nasal trauma, very important topics. So first I will make a list here. At the last we will be using this segment. So first it means you should be confident of site of lesion. Where is the pathology in the larynx? Where is the pathology in larynx? Second MCQ, maximum hearing loss. They always make a question on maximum hearing loss. Why it is important? I am sitting in the OPD. I want to make a diagnosis without going for CT examination, radiological investigation. So I will go just for PTA, pure tonodrometry, and I will be going for that. This is again a PYQ of your central institute. If it is a vertical fracture, it is Chevalier fracture. And what examiner asks you in your central institute? This is Jarjavi fracture. So with a third important topic, most important topic, here comes your trauma, that is facial trauma. If examiner will ask you MCQ on facial trauma, why? It will cover anatomy and ENT with ortho. So this is one of the important integrated question. Which are the important points? They can ask you the lateral view of nasal bone, fracture is visible. Can you see the fracture here? Discontinuity here. Yes, nasal bone fracture is the most common fracture. Just remember, it is most common. Second most common is zygomatic fracture. So either they will ask you on nasal bone fracture or they will be asking you on zygomatic fracture. What are the two T which should be on your tips? One is tripod fracture. They can ask you tripod fracture, or they can ask you teardrop sign. Tripod fracture or teardrop sign. These are the two important points. Then most common facial fracture is nasal bone. Second most common is zygomatic fracture. Is it clear? They can ask you teardrop sign, but if they give you the option of blowout fracture, that is a better than zygomatic fracture. Is it clear? One MCQ I am expecting this year on Leaf-Ford classification, because these questions have come alternate year. So in the last 2 years NEET, they have not asked you anything on Leaf-Ford. This year I am expecting they will ask you in Leaf-Ford fractures one day before the examination. अगर मैं आपसे पूछता हूँ बेटा revise the topic in 1 minute, so you should say, so Leaf-Ford 1 along the floor of maxilla, it is known as low maxillary fracture. It is also known as floating palate. It is known as urine sign. There is a bleeding spot over the palate. Leaf-Ford 2 is known as pyramidal fracture. Leaf-Ford 3 is known as craniofacial disjunction. And Leaf-Ford 2 and 3 I can have CSF rhinology. This is something required 1 day before the examination. Beta suno dhyan se, those students, because of any unavoidable circumstance, if you couldn't study in last 6 months, no worries beta. Let's use DVT to revise all the 19 subjects in this mode. No idea about Leaf-Ford fracture, no worries beta, no regret should be there. Sir 5 question hai yaad hone chahiye. Leaf-Ford 1 low maxillary, floating palate, urine sign, pyramidal fracture. Leaf-Ford 2, Leaf-Ford 3 is craniofacial disjunction. That's it. CSF rhinology more in 3 than 2. If examiners show you this slide, this is bleeding spot over the palate, that is Leaf-Ford 1 urine sign. Is it clear? This is your Jarjavi fracture, this is Chevalier fracture. Topic over. This is CSF rhinology, where they can ask you, your examiner is obsessed with this sign. What is this sign? Known as halo sign, target sign, or double ring sign in traumatic CSF rhinology. Is it clear? So 1 week before the NEET exam, this topic of facial fracture should be revised in max 5 minutes. Beta, इससे ज़्यादा time नहीं देना हमने. The way I am doing on this platform is to give you a message कि जो बच्चा speed पे fast mode में याद करेगा, he will manage to do 4 revision. And success mantra for NEET examination is your number of the revision cycle. बिल्कुल simple सी बात है बेटा. And you will remember my words in the examination hall. जो बच्चा जितनी बार revise करेगा, he will get top ranks. मैं एक very strong analogy आपको दे रहा हूँ. I am giving example. You are having 5 days. either you study all the 5 days, you read all the new topics 5 days, or read the topic for 2 days and the rest 3 days revise the topic 3 times. That is your choice. Most of the students these days, they are running behind quantity. Take my words well. Nowadays it is very easy to crack the examination. Why? Most of the students are distracted because everything is there on their mobile. They are distracted, they are studying, they are trying to read everything. But those students who know the game, the rule of the game, कि 2 दिन पढ़ना है, बाकी 3 दिन revise करना है. Is it clear? I hope you are getting the message. So let's follow the second rule and try to revise maximum time. Our motive behind conducting these sessions to give you a message कि बेटा बड़ी simple चीजें हैं, इनको complex नहीं करना. Question number 4. Patient difficulty, some X-ray, ENT with PEDS. Integrated question. If they ask you ENT with PEDS, they will be asking you the question on epiglottitis against group. ये आना ही आना है बेटा, इसको भी याद कर लेते हैं. Mastery of epiglottitis with group. 1 day before the examination, if you ask me कि बेटा sir I want to revise epiglottitis with group, तो कैसे रिवाइज करेंगे? Epiglottitis sir, emergency. E for epiglottitis, E for emergency. Is a acute, is a high grade fever. High grade fever. Beta, I have deliberately done the background black so that you can focus on my words. Epiglottitis, acute, it is emergency, is high grade fever. We will go for step 2. But if history of vaccination not known, I will go for H influenza. Treatment, IV antibiotics. Thumb sign, patient always keep the neck straight. Why? Because airway compromise. And what is the golden rule of epiglottitis? Never give painful stimulus to the patient. 1 minute you should be able to revise the topic. Emergency, high grade fever, epiglottis, so inspiratory dyspnea, thumb sign positive, IV antibiotics, bacteria strep 2. If history of immunization is not clear, I will go for H influenza. Never give painful stimuli. बेटा ये 8 पॉइंट हैं, याद होने चाहिए. इसमें से एक पूछेंगे. थम्स अप इन द चैट बॉक्स इफ यू गेट द मैसेज एंड यू आर लविंग द सेशन. समझ में आ रहा है बेटा गेम कैसे खेलनी है हमने? वी हैव टू प्ले द गेम इन फास्ट मोड. क्रूप सर, C for croup, C for chronic, also known as laryngotracheobronchitis. L for low grade fever. Lower part involved biphasic dyspnea or expiratory dyspnea. Which viral? Para, influenza, PI, para. Yes. Type 1, type 2, type 3. Last AIMS examination, they have given 3 option bacteria, 1 option viral. Go with the viral. Any viral, they have given influenza virus, para-influenza virus. Go for that virus. Is it clear? Epiglottitis bacterial, para-croup is your viral. Viral, so symptomatic treatment. Which sign, sir? Stipple sign. Thumb sign, epiglottitis. Stipple sign, croup. That's it. बाहर आ जाओ टॉपिक से. I hope you are getting my point. इन 2 टॉपिक्स की बेटा इससे ज़्यादा आपकी लाइफ में इंपॉर्टेंस नहीं है. इसके ज़्यादा हमने इसमें रिसर्च वर्क नहीं करना. आई होप यू आर गेटिंग द पॉइंट्स. क्लियर? बातें समझ में आ रही है. दिस इज योर स्टिपल साइन, सो इट इज क्रूप. दिस इज योर थंब साइन, सो इट इज योर epiglottitis. Epiglottitis. Done. Barking, cough, lower respiratory tract, going in the favor of croup again. Clear? After learning, yes beta, first we have to secure the airway. Absolutely, answer will be airway management. Question number 5. Study a given slide, choose the most appropriate diagnosis. What I am showing you here comes the most important topic. एक क्वेश्चन तो मैंडेटरी आना ही आना है. कौन सा है? एंजियोफाइब्रोमा, और दे विल आस्क यू नेसोफेरेंजियल कार्सिनोमा. सो बेटा नेक्स्ट टॉपिक कम्स हियर, एंजियोफाइब्रोमा अगेंस्ट नेसोफेरेंजियल कार्सिनोमा. मोस्ट इंपॉर्टेंट टॉपिक. I should label on the top. If I have 5 minutes to read ENT, I should read angiofibroma against nasopharyngeal carcinoma. बेटा ये 2 टॉपिक्स हैं, इनमें से क्वेश्चन आना है. This year I am having a strong intuition that they will be asking you something on nasopharyngeal carcinoma. Angiofibroma, 14-year-old boy, recurrent epistaxis, sphenopalatine foramen, frog face deformity, Hallman-Miller sign, investigation of choice, 2024 NEET examination, CT examination. Clear? We will do surgery. We will do every method to reduce the size, like embolizing internal maxillary artery. But what we will not do, last INACT, that is your biopsy. Again, 14-year-old boy, testosterone dependent tumor, sphenopalatine foramen, recurrent epistaxis, frog face deformity, Hallman-Miller sign. On CT, investigation of choice, no biopsy, operate, surgery, everything to reduce the size of the tumor, like internal maxillary artery. embolization. These are the important words. Nasopharyngeal carcinoma. In the MCQ, they will mention the word Chinese or Northeast word will be there. Epstein-Barr virus will be there. Patient have unilateral cervical lymph node. Trotter's triad. Fossa of Rosenmuller. Treatment radiotherapy plus chemotherapy. These are the mandatory words for nasopharyngeal carcinoma. बेटा मैंने ना इस टॉपिक को आधा घंटा नहीं पढ़ना, मैंने इसको 5 मिनट्स पढ़ना है, उस 5 मिनट्स में टॉपिक को रिवाइज करना है, बाहर आना है. आई होप यू आर गेटिंग माय पॉइंट. सो दीज आर द फर्स्ट 5 important topics I have discussed with you. I am showing you Hallman-Miller sign. What is Hallman-Miller sign? Sir, posterior wall bending down. There is a pressure coming from behind. That is naso-air angiofibroma. Is it clear? Last FMGE, they have given a very nice question, very nice MCQ. I will say the best MCQ in the last 5 years. They have given a history of 50-year-old patient from Northeast complaining of hearing loss. On examination, bulging tympanic membrane or dull tympanic membrane was given. On tympanometry, they have given flat tympanogram as shown in the image. देखो पूरा माहौल बनाया हुआ था for serous otitis media. This was a typical history given in MCQ. 50-year-old patient from Northeast complaining of hearing loss, dull tympanic membrane. On tympanometry, tympanogram was flat. 5 lines dedicated to serous otitis media, and the last line they mentioned on neck palpation there was a small lymph node present in the posterior triangle of the neck. Which of the following is a management? 4 options थे. In the 3 options पूरा माहौल था of serous otitis media. Myringotomy with grommet insertion, myringotomy with grommet insertion with adenoidectomy, and last में छोटा सा word लिखा था radiotherapy. That is one of the best tricky MCQ to confuse the student. Answer will be radiotherapy. Answer will be radiotherapy. I will not be going for this. Is a typical finding for nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Is it clear? Done. This is your frog face deformity. This is your frog face deformity. I hope everybody is loving the session. My motive is to give you some momentum better so that you can play the game confidently in the upcoming days. Question number 6. All of the following are hallmark feature of the pathology shown in the given image. Let's crack this one. इसको crack करते हैं बेटा, ध्यान से crack करते हैं. Listen carefully. How? देखो, make a diagnosis. This is tympanic membrane. Everybody knows this is tympanic membrane. Where is the pathology? Upper part. What concept we made in the classroom? If you remember, we have taken the middle ear as your classroom as a middle ear, and the room behind your classroom is mastoid. If the disease is in the upper part, it is your tubotympanic ear beta. Tubotympanic ear. And what we go for? We go for tympanoplasty with OCR. Tympanoplasty with OCR. If the disease is in the lower part. If the disease is in the lower part. If disease in the lower part, I'd have taken this as a lower part. If the disease involve part tensa, we call it as tubotympanic. Tubotympanic. I always say part tensa, tubotympanic. Treatment T, tympanoplasty with OCR, ossicular safe or ossicular chain reconstruction. Disease in the upper part. What is the upper part known as? Attic area. We call it as atticoantral. What is the treatment? MRM, modified radical mastectomy. Dr. Mohammed, thanks with 10 words which go in the favor of unsafe. Writing this 10 word in the chat box, that's the best part. We have 10 words. Which are the 10 words? In the MCQ, cholestroma word is there, scanty word is there, attic word is there, Otitis is there, antrum is there, foul smelling is there, polyp is there, granulation is there. I'll be going for unsafe ear. Now what is shown in this image? Pathology is in the upper part. If it is in the upper part, it is unsafe ear. So which of the following is not a finding? Granulation. Yes, it is a finding. Copious discharge, scanty discharge. It is not copious because everything is obstructed. That is, everything is obstructed. So very less discharge is coming out. So answer will be here. Here, scanty discharge is the hallmark finding. Scanty discharge is the hallmark finding. Is it clear? Expect one MCQ on CSOM mandatory. The next MCQ from Rhinology, I am showing you a slide. South India is mentioned. Northeast going in the favor of nasopharyngeal carcinoma. Southeast with the history of nasal obstruction. On examination, papillomatous mass, erythematous, reddish papillomatous mass obstructing the nasal cavity. Choose the most appropriate diagnosis. What is the right answer for this MCQ? You tell me. Big spores visible. I will be going for rhinospodiosis. We call it as rhinospodiosis. Anybody, any student who can write in the chat box what will be the typical history mentioned in the MCQ. इस क्वेश्चन में कौन सी typical history will be there? Yes, any student? Which typical history will be there in rhinospodiosis? Rhinospodiosis. Yes, anyone? Typical history of taking bath in the ponds. So they will be mentioning one history, typical history. A patient have a history of taking bath in the ponds. Clear? Diagnosis going in the favor of rhinospodiosis. What is rhinoscleroma? Here the key word will be foul smelling in the MCQ. Patient from the northern part of the country, foul smelling discharge with woody nose. If examiner mention the word woody nose, I will be going in the favor of rhinoscleroma. What is rhinophyma? Is your hypertrophy of sebaceous gland known as potato nose. Hypertrophy of sebaceous gland. Is it clear? These are the 3 slides I am showing you. बेटा इसको ना इनमें से एक आना ही आना है. There is a high probability कि 2 पूछ लें आपसे. rhinophyma, rhinoscleroma, rhinospodiosis. Microbiology people, ENT people fond of asking this point. Sebaceous gland hypertrophy, potato nose. Here rhinoscleroma, woody nose. It is associated with Klebsiella, a drug of choice, streptomycin or tetracycline. Here it is rhinospodiosis. Treatment is surgery. But what is mandatory? I'm waiting for a response in the chat box. Anyone who can tell me rhinospodiosis, what will be the mandatory thing in surgery when we operate the patient? What is the mandatory? Mandatory is cautery at the base. We have to do cautery at the base. Cautery at the base is mandatory. Is it clear? Cautery at the base is mandatory. Done. Then I'm showing you few slides. This is woody nose. When I touch the nose of the patient, it is woody nose. In rhinospodiosis, you will get big spores. But in rhinoscleroma, you will be getting Mikulicz cell. You will be getting Mikulicz cell and Russell bodies. Clear? And patho people will make you master of this slide. Honestly, being a ENT faculty, I have no idea about this slide. मुझे ये पता है Mikulicz are macrophage, Russell are eosinophil. How to identify? Your patho people, patho faculty will teach. Is it clear? Cautery at the base is mandatory in rhinospodiosis. Is it clear? Crystal clear. Done. After learning, the next is MCQ from pharynx. अब देखो बेटा, pharynx में 2 क्वेश्चन है. There will be 2 MCQs in pharynx. One will be in ENT. They will be asking you either angiofibroma or abscess. In anatomy, they will be asking you the anatomy of tonsil. You should be master of all the boundaries of the tonsil, medial boundary, lateral boundary. I'm talking about must-read topic. Or they will be asking you something on your superior constrictor, inferior constrictor, middle constrictor, layers of the pharynx, because in the last Central Institute examination they have asked you this point. So this is very important. Is it clear? Crystal clear. Now we have 4 levels actually. This is base of skull. This is your superior constrictor, middle constrictor, inferior constrictor. So from base of skull, this area is known as sinus of Morgagni. Sinus of Morgagni, from where the ET tube passes. Eustachian tube is there. Between superior constrictor and middle, this area is dedicated to the 2 best friend, that is your stylopharyngeus and nerve supply of stylopharyngeus, that is 9th nerve. If this is styloid, if you ever ended the anatomy session, this styloid, the 9th nerve is very close to styloid process. Between middle and superior is your internal laryngeal nerve or superior laryngeal artery, and below is the inferior laryngeal artery or recurrent laryngeal nerve. These are the important areas in my pharynx where the important structures enter. And this was your 2024 P by Q. So this is very important. Which structure is crossing at which level? Is it clear? Coming to the next one, this is I have given you in this PDF file. Question number 9 is patient is history of ear discharge on examination, perforation seen on anterior-inferior segment. Again, the last NEET examination. So what message this MCQ is giving me? That we should be master of subjective audiometry. Beta, one MCQ from subjective, one from objective, mandatory. So can I add the list? Must read topics are here. Concentrate on the board. Pharynx, all the anatomy layers of the pharynx and all the structures passing from the pharynx, they will be asking the MCQ. One is here subjective audiometry. Subjective audiometry MCQ will be there. One is your objective audiometry. Objective audiometry. Okay. So one is subjective audiometry, one is objective. Subjective audiometry, one is pure tone audiometry. Very important. They will be asking you something on PTA. I will be discussing all the 10 graphs of PTA. They can ask you something on Rhinis, like last NEET examination. They have shown you the tympanic permanent perforated. Now, what is Rhinis? Rhinis, we have three possibilities: Rhinis positive, Rhinis negative, and false negative Rhinis. Rhinis positive is seen in normal sensory deafness, neural deafness. Rhinis negative, conductive deafness. It is false negative, severe unilateral sensory neural deafness. Rhinis positive, Rhinis negative. Is it clear? You should be master of Weber beta. I am giving you 4 important points in this slide. One is Weber. अब Weber में क्या है बेटा? We have 3 concepts. It is centralized. It is centralized in normal human being. It is lateralized to normal ear, better ear in sensory neural deafness. It is lateralized to worse ear in conductive deafness. These rules should be on your tips. Done. Then they can ask you the best investigation for bone conduction test is ABC. और यहाँ पे मैं लिख रहा हूँ 2025 NEET examination. I am expecting on MCQ on ABC. What is ABC? Absolute bone conduction test. So in ABC, always remember this point. It is reduced in sensory neural deafness. ABC, absolute bone conduction test, is reduced in sensory or neural deafness, and it is same as examiner. It is same as examiner. Perception is same as examiner in 2 normal cases as well as in conductive cases. ABC will be reduced. Is it clear? Absolute bone conduction test reduce in sensory neural deafness. My ear absolute bone conduction test is reduced on the right side. I am suffering from right side sensory neural deafness. बेटा important point है, इसको भूलना नहीं, याद रखना है. Clear? So Rhinis clear. Weber we have done. Tunic fork test, basically Rhinis positive. This is something I am showing you from my workbook. Last year there were 2 MCQs from this single page of 91. What we are doing in our workbook based teaching, we are making our student write all the PYQs better. Clear? So important, Rhinis positive means amplification positive. It is seen in AC, better than BC, normal, sensory and neural. Rhinis negative means no amplification, bone conduction better than ear conduction. It is seen in conductive deafness. Conductive deafness. Clear? So Rhinis conductive deafness is negative. The day you start making the flow chart, day you start making mind maps, differential diagram, take my word, you are on the other side of the game. Always try to concise the topic in form of mind maps, flow charts or tables. Sensory neural deafness positive. Weber in normal, not lateralized. Lateralized to disease ear in conductive. Lateralized to normal in sensory neural. Sensory. Is it clear? Dr. Ashita, very good beta. Schaubeck. Schaubeck test is having a drawback. In Schaubeck, ear conduction is disturbing. Therefore, we prefer ABC. Why I am so confident that they will be asking an MCQ on ABC? Because it is much authentic if we compare with Weber or Rhinis or Schaubeck. Is it clear? Clear. OAE, otoacoustic emission, is a marker of, one MCQ expected on otoacoustic emission, that is a marker of outer hair cell. It is a marker of outer hair cell. Is it clear? It is a marker of outer hair cell. The only drawback, why? First of all, OAE, autocaustic emission, should be used in all newborns. So most important is autoacoustic emission should be used in, it should be used in all newborns. Clear? And we should do as soon as possible. But what is the drawback? Anybody who can write in the chat box, what is the drawback of OAE, autocaustic emission? They may be absent. They may be absent in normal cochlea. They may be absent in normal cochlea, or they may be blocked by middle ear pathology. They may be blocked by middle ear pathology. That's why we are using in as a screening. Is it clear? The first 10 MCQs done. Coming to the next one, question number 11. Whenever there is a paradox, that is a potential MCQ. So which of the following structure is pointed out? So I'm teaching you the anatomy of nasal septum. We have three major parts. One is your perpendicular plate of ethmoid, one is vomer, one is quadrangular cartilage. Clear? Which are the minor components are known as spine. This is spine of frontal, this is spine of maxilla. But what is this area which is contributing? That is sphenoid. Which part of the sphenoid? It is known as rostrum of sphenoid. So the spine of sphenoid, where is the spine? Spine is the most posterior part of sphenoid. It is not contributing, it is rostrum contributing. So expect one MCQ on nasal septum. On nasal septum, expect one MCQ. Is it clear? Done. So can we add in the list? Nasopharyngeal carcinoma, objective audiometry we have discussed, or one MCQ in objective audiometry, septum. Now question is, let's crack this point. Okay, what they will be asking on the septum? Either they can ask you the MCQ on rostrum of sphenoid, one question, or the second point is they can ask you something on septoplasty against SMR, submucous resection. So what is SMR? Is a history, past history. Now we are doing septoplasty. SMR, there is a high risk of perforation because the our HOD used what they used to do 20 years, 30 years back. They used to give incision on both sides. They give incision on both sides of the septum and they remove the whole septum. So there is a high risk of perforation. But in septoplasty, we are giving unilateral incision and we are just removing the deviated part. So last NEET, they have asked you, they have shown you a nice image of septal perforation and they ask you which surgery was done in the patient. So just which surgery was done, beta? It was SMR. So this year I am expecting they will ask you something on septoplasty or SMR. One question they can ask you whether it is septoplasty or rhinoplasty. This is again a very favorite segment. Septoplasty against rhinoplasty. अब ये क्या concept है बेटा? Listen carefully. If I am giving the incision on the septum, it is septoplasty. And if I give the incision on the skin, like you touch your lower part of the columella, here I create a W-shaped incision and I raise the flap. So that this incision on skin, if examiner show you the incision on the skin, that is rhinoplasty. On the mucosa, we are going for septoplasty. Just remember this concept. So septum, very important topic for ENT. So they will be either asking you on septoplasty or rhinoplasty. Is it clear? Coming to the next one, nasopharyngeal carcinoma MCQ dedicated 66-year-old Chinese patient. Chinese aate hai na beta. Don't waste your time in reading them. Posterior triangle, lymph node. It is nasopharyngeal carcinoma. Which of the following is a true statement? Very nicely formatted question. Holman-Miller sign is a hallmark feature. Not at all is a hallmark feature. Angiofibroma. Ascending pharyngeal artery should be ligated before surgery. Nasopharyngeal carcinoma, we are not going for any embolization and surgery and all those points. No. MRI will be giving a lesion in the left fossa of Rosenmuller. Very true. Pathology is only seen in old patient. Why it is false statement? Let's see who reply in the chat box. Any student, why the D option is false? Tumor is always in the old patient. So I feel that this statement should be true. Anyone who can write in the chat box why this is false statement, why this is false statement. Anyone who can update in the chat box why this is a false statement. Because nasopharyngeal carcinoma have bimodal, very good, bimodal distribution with a one peak at 20 one peak at 60, one peak at 70, one peak at 60. Is it clear? Crystal clear. Coming to the next one, there is some errata in this question, beta. Answer key: 46-year-old female, 2 days of history of right ear pain without fever. She denies feeling pain deep in the ear area. She have no history of similar pain in the past. No erythema. Which bacteria is the most common cause? Is it the diagnosis for perichondritis? Perichondritis. If perichondritis, I will be going for Pseudomonas. Like, listen carefully. Perichondritis, or they mention diffuse otitis externa, or they mention malignant otitis externa. Malignant otitis externa, expect one MCQ in the upcoming NEET examination, because malignant otitis externa, this question will come alternate year. Last year this question was not there. This year I am expecting they will be asking you most common bacteria of necrotizing otitis externa, malignant otitis externa, all the one and the same, that is Pseudomonas. Is it clear? So bacteria, Pseudomonas. Drug of choice will be third generation cephalosporin. So this is perichondritis, malignant otitis externa. Which are the 5 must-read topics? A diabetic patient. It is diabetic, must-read keywords. Diabetic patient. It will be facial nerve palsy with ear discharge. Facial nerve palsy with ear discharge. Technetium 99 scan. Gallium scan. Technetium 99 scan for diagnosis. This is for prognosis, and management is medical treatment. Medical treatment. Clear? So surgery is rarely done, that is debridement. We are doing debridement very rarely in case of malignant otitis externa. Is it clear? Done? Clear? So this is very important topic, the topic of your perichondritis or diffuse or malignant otitis externa. Question number 40. A 15-year-old boy with history of hearing loss, mass, hard mass, was noted in the external auditory canal. What is the most common diagnosis? Can you appreciate? There is a mass here visible to you on, yes, radiology investigation on your CT image. You are seeing this one. This cannot, it is not a evidence of necrosis, cholestoma ruled out. Let's learn. External auditory canal osteoma. Now listen carefully. Why it is not exosteosis? I'm waiting for response. Anybody who can write in the chat box, why not B is the right answer? B is exosteosis, that is osteoma formation, and I'm giving you the right answer of external auditory canal. Yes. Why not B is the right answer? Exosteosis. Yes, wrong. This question you attempted wrong. Why not D? One student is asking me why. Hard mass. .sk. Exosteosis is a bilateral osteoma formation. Can you see in this MCQ there is a left other side canal is absolutely normal. Can you see there? This canal is normal. It is unilateral. So I cannot go for exosteosis. This is very tricky question. Answer will be C option. Now one student is saying why not keratosis obtrans? Keratosis obtrans, because this student is saying it is 15-year-old boy. It is commonly seen in 5 to 20 years. Keratosis obtrans is a growth abnormality, again bilateral. When it is a growth abnormality, it cannot be only one external auditory canal is involved. Beta, one of the best MCQ where option B and D both are ruled out. B and D are ruled out only because of bilateral condition. Very good. Keratosis obtrans. Everyone is responding in the chat box. That's the best part. These are bilateral condition. Because they are bilateral condition, I will rule out. The pathology is in only. Kindly thumbs up in the chat box if you get this message. Ye samajh mein aaya beta? How we rule out? How we rule out? Yes. So must read topic. Next line comes. It is perichondritis or diffuse otitis externa, malignant otitis externa, or they will ask you something on osteoma. Why osteoma? Because it is the most common tumor of paranasal sinus, most common tumor of external auditory canal. So they will be either asking on paranasal sinus or external auditory canal. Is it clear? Exosteo, yes, what possibility is there? If it is a larger in size, it can be. Coming to the next one, question number 15. Graphs shown below are related with That is subjective objective audiometry. I have given you both. That is PTA. Can you tell me there is a big airborne gap? Because there is a big airborne gap, I'll be going for conductive deafness. Conductive means there is something in the middle ear. What is there in the middle ear? Extra fluid in the middle ear. So I'm getting which tympanogram? I'm getting flat tympanogram. Okay, so now we are concentrated on the board how to crack, how to learn these pure tone audiometry concepts. This is 25 decibel. If I say, can revise these graphs in 1 minute, is it possible? Possible. If it is cutoff marking 25 decibel, if air conduction, bone conduction are within 25, it is normal. And if both are beyond 25, it means it is sensory neural. And if air conduction is abnormal and bone conduction is within, it means big airborne gap. I make a diagnosis of conductive deafness. This is known as airborne gap. Now, like last INCT, they have asked you this question. Both the graph are beyond 25 and big airborne gap. That is mixed deafness. And I hope all the students who are listening to me, you must have revised audiometry nicely. Again, both the graph within 25, normal. Both are above sensory neural. Both are big gap. It is sensory neural with conductive mixed deafness. Examiner will give you either loss at 2000 or loss at 4000. If loss is at 2000, it is Carhart notch. Loss at 4000 is noise-induced trauma. Carhart notch feature of otosclerosis. Clear? Either examiner will give you, ये दोनों graph both important है pure tone audiogram. Can you label what is X, what is Y? Can you label what is X, what is Y? I'm waiting for a response. If graph is moving up, pure tone audiogram, rising curve. What do you mean by rising curve? Concentrate on the board. Rising curve means low frequency inward. Low frequency have very high threshold. Therefore, this is low frequency hearing loss, Meniere's disease, Meniere's. And this graph is coming down, down, down. It is down sloping graph seen in old age, that is presbycusis. Is it clear? So these are the important topics, important graph related with pure tone audiometry. Normal, conductive, sensory, neural, mix. 2000 loss, 4000 loss, rising curve, low frequency and down sloping presbycusis. Done. Tympanograms. As far tympanograms are concerned, we are having 5 important tympanograms. Beta, this is normal. Again, I have taken this screenshot from my workbook. Flat tympanogram or B tympanogram. It look like this. This is flat or B tympanogram. Flat is seen in fluid and B is seen in perforated. If the graph is shifted on the x-axis, it is known as C tympanogram. And if the graph is less mobile, hypomobile, we call it as AS graph. This is known as AS graph. And if the hypermobile graph, AD graph, we call it as AD graph. Is it clear, beta? So these are important tympanogram. First staging system of tympanic membrane retraction was proposed by Sede, TOS and Sede. Sede is your part tensor, TOS is your part flaccida. We have to match the following. Very important MCQ. Grading. Grade 1 is mild retraction. So this is mild retraction. Grade 2 will be severe. Grade 3, the middle ear is collapsed, the tympanic membrane touching the pulmonary. And grade 4, it is attached with the pulmonary. So answer will be here. 1 is 4 is A, 2 is here C, going with the option D. So with the help of this, and how to attempt the match the following, try your best to rule out the options better. In this, you should try your best to rule out the option. If you find one staging, then one stage 1, then mild retraction. If it is mild retraction, if it is 4A, it means option A ruled out. So just try your best to ruling out the option. Question number 17. Again, last NEET, your PYQ, very important, pulsatile. Even I cannot read the CT finding. I have no idea about the CT finding. Even then, you should attempt the MCQ. Pulsatile means glomus tumor. But there is a catch in the MCQ. They have given, last NEET, they have given 2 options. Glomus jugular or glomus tympanum. In CT, they are showing you flap sign. Loss of bony partition between carotid and jugular. Carotid and jugular. So I will be going for glomus jugular. So better answer will be B option here. Rising sun sign, brown sign, that is brown is blenching of the tumor on pressing the tympanic membrane. All these points should be on your tips. Flap sign, my workbook page number 163, the same finding was shown in your examination. This is normal on one side and there is some tumor on the other side which destroy the bony partition, Done. Question number 18. Important PYQ, that is your tonsillectomy. Expect one MCQ on the tonsil, like I have mentioned already, layers of the tonsil or tonsillectomy. The patient was operated, post-operative was uneventful, so the patient was discharged. Wednesday he was operated, after 3 days on Saturday, emergency with complaint of mild bleeding from the oral cavity. So patient, now what is this one? This is something bleeding after 24 hours. It is secondary bleed, and if it is secondary bleed, what is the treatment? Treatment will be your IV antibiotics. Is it clear? Primary on table, reactionary within 24 hours, and secondary is your after 24 hours. Is it clear? Primary, ligate the vessel, reactionary takes you the patient to OT. This religation option, that is here for reactionary, and their infection will be for tertiary. CA larynx, mandatory topic, आना ही आना है बेटा, on must read topic, that is your carcinoma larynx topic. TNM classification should be on your tips. T1, T2, T3, T4, management part. T1, T2, we prefer radiotherapy, and very rarely we are going for your partial laryngectomies. MCQ, high probability, they ask you T3, T4. Now you will say, sir, why high probability? Because in clinical practice, in my OPD, the most commonly patient present in either T3 or T4. So what is the treatment in the medical college? Most commonly patient coming here, T3. So treatment is total laryngectomy with radiotherapy. Clear? One student is asking me, doubt. Dr. Shiv Kumar, beta, please write again. Clear? Please write again. What is your doubt? In question number 14, how to differentiate B and D? Please, definitely, beta. Panic nahi karna, relax mind. Clear? Because the chat box is moving at very fast speed. Now, sometime I miss the query. So don't panic. Just ask the query again. Next few days, beta, relax mind. Peace of mind, the first step to get top rank. Make a promise. Dr. Shiv, beta, make a promise. जो बच्चे ना बिल्कुल रिलैक्स मोड में जाते हैं ना, they always get top rank. पैनिक नहीं करना. नहीं, if I couldn't reply, just write again. I will. No worries. 15-year-old boy. What is your query? How to differentiate between B and D? B and D. Osteoma and keratosis of trans. Beta, osteoma. This is tumor. This is. Okay, I got your query. Okay, sir, both are bilateral. So how you will differentiate? This will be one condition. This is tumor. In this, the patient will be giving a typical history. So not as swimming, cycling or surfing. So the patient will be somewhere 20-30-year-old young patient going for swimming, cycling, surfing. The both ear have osteoma. We call it a surfer ear. यहाँ पे typical history क्या है आपकी? 5-year, 6-year-old child. The patient is having squamous debris in the canal. So what keyword will be here? The keyword squamous debris. अगर ये word नहीं है, I will never go for keratosis of trans. Cholestoma and keratosis of trans both are squamous. Difference is cholestoma, we have evidence of necrosis. I hope you got the message, beta. Keyword squamous debris have to be there. Chalky white, yes. One of student Twinkle is writing chalky white. Yes, very true. But if the examiner mentions cycling, swimming or surfing, that is going in the favor of osteoma. Is it clear? Is this clear? Yes, beta. Dr. Shiv Kumar, clear? Now, management part of, and make one promise, beta. Next, I will know it's very easy to say, difficult to do. You are under big pressure of 19 subjects. बिल्कुल गुस्सा नहीं करना, बिल्कुल relax mind से just play like cool captain MS Dhoni and crack this examination. Clear? बिल्कुल relax. Make a promise to me कि next upcoming days ना बिल्कुल peace of mind रखना है आपने. Then study the given image. Comment on the TNM classification. Not only for NEET examination, even the rest of your life now. If you want to be on top, keep peace of mind. Clear? So this is image I have taken from your Center Institute. They have shown you a mass rupturing the thyroid cartilage. Clearly visible, and the tumor have invaded all the neck muscles. Because the tumor invaded on the neck muscle, I will be going for T4. If it is only cartilage, if the tumor is not going outside the cartilage, I can go for T3. But here the cartilage invasion, cartilage is completely damaged and the tumor is outside this. And what is this one? This area will be your muscles involved, neck muscles involved. It is T4. Done. After learning all these basic points, classification should be on your tips. Question number 20, last MCQ, papillomatosis. Why? Because this is most common benign tumor. This is the most common benign tumor. Most common malignancy is carcinoma, squamous cell carcinoma, and here we are having benign papillomatosis. Which drug is approved? Intralesion cidofovir. We are not using this commonly. Why? It have many complications. Because it have many complications, we rarely use this. Is it clear? CT examination, for learning this, to read this CT, your TNM classification should be very strong. T1, T2, everybody knows that 1 unit or 2 or 3 subunits is T2. T3 is your paraglottic space involved, or your pharynx involved, or perichondritis, cartilage involvement. What is T4? T4 involvement is thyroid muscles. The muscles attach on the thyroid cartilage muscles attach. That is known as sternothyroid or inferior constrictor or thyrohyoid. If these muscles are involved, then we go for T4. Now here what the examiner is trying to show you, okay, the tumor is starting in the larynx. It have invaded the cartilage. It have destroyed the complete cartilage and it is going outside the larynx. So this is better to go with T4. It is outside the, very good. Clear? T4A, T4B. T4A will be this thyroid trachea involvement, tongue muscles involvement, and T4B is going to the chest, or it is going to the carotid artery or prevertebral space. So in this, the answer will be a D option. Is it clear? I'm showing you two papillomas. Identify what is X, what is Y. So in X, I can appreciate multiple papilloma. Multiple, if they are multiple, that is juvenile papillomatosis. Here I'm getting only one single papillomatosis, that is your juvenile or senile. As for single, as for senile, here I'm having senile. Is it clear? One is juvenile, one is senile. Is it clear? Thank you, Dr. Sapna. Thanks for all the compliments you are writing in the chat box. My only motive is to make the thing simplified. Never create a pressure case. समझ में नहीं आया. Obviously, when you will do radiology post graduation, you will learn all these things. यहाँ पे तो हमने सीखना है how to crack the MCQ. You are going for a examination where we have to learn the skill. So it is juvenile, multiple, resolve spontaneously, reoccur spontaneously. Let's see who reply in the chat box. Any student who can tell me which will be the key word for papillomatosis. कौन सा ऐसा word है जिसको देखते मैं कहूँगा papillomatosis? Anyone? I'm waiting for the response in the chat box. Everybody should reply. Yes, anyone? Any student? Any student who can tell me what will be the keyword which will make a diagnosis of papillomatosis? Beta, एक papilloma, then 2, then 4 papilloma go on increasing. That's come the best reply in the chat box. Dr. Shiv Kumar, Dr. Hina, great. Progressive hoarseness. In the MCQ, if they mention the word progressive hoarseness, I will be going for laryngeal papillomatosis. Is it clear? Expected MCQ for your upcoming NEET examination. So motive of this session was to give you must-read topic with this slide. Very important. Take a screenshot. Angiofibroma against nasopharyngeal carcinoma. Site of lesion. We have to decide whether it is supraglottic, subglottic. Maximum hearing loss in which condition? Facial trauma. Epiglottitis against group. CSM against ASM, rhinoscleroma, rhinophyma, rhinosporiosis, layer of the pharynx, very important. One MCQ from subjective, one from objective. Septum is very important. They can either ask you rostrum of sphenoid or septoplasty SMR, or how to identify the NCL. Perichondritis, diffuse otitis externa, malignant otitis externa, and osteomas, very important. And last segment is CA larynx, and papillomatosis. They are the important topics. I hope you loved the session. You got the message how to proceed in a very fast mode and work on the keywords. Now let's take the query. You can, Dr. Harsimran, you can ask in the Telegram group. Clear? You can even ask on these platforms whenever we are conducting the session. Question number, repeat the last MCQ. The last MCQ is dedicated to papillomatosis. They are giving direct diagnosis papillomatosis and they are asking drug of choice. So what is the drug of choice? Treatment of choice is CO2 laser, but drug of choice is here intralesion pseudophore. One student, Dr. Twinkle, is asking retropharyngeal abscess versus parapharyngeal abscess. I will explain beta. Yes, they are important. They are important. Abscess, I have highlighted this point. Either they will ask you angiofibroma or abscess. In pharynx, they will be asking you abscess or angiofibroma. Abscess, parapharyngeal abscess, swelling in the lateral wall, and tonsil will be pushed to midline. Parapharyngeal abscess, most common abscess. Treatment, IND along anti-surface of sternocleidomastoid. Retropharyngeal abscess is on the posterior wall. It is a swelling on the posterior wall. It is a localized swelling on one side. Prevertebral abscess, again on the posterior wall. Retropharyngeal on the posterior wall. Para on the lateral wall. This is the way we differentiate one from the other. I hope you got the momentum in the last 1 hour. My only motive, beta, you should work hard, be a fast learner, try your best to be a fast learner, not only for PG entrance exam, but even for the rest part of your life. Best wishes. Clear? We all are waiting for your great results and we are waiting for you. We are confident you will be coming with flying colors. Clear? Best wishes, best of luck. Next couple of days, work hard, beta. Work 24 hours in 24 into 7 and work more on the revision part rather than